Well, good afternoon. Welcome to everybody who's joined us today. I think we have close to 300 attendees registered for today, so that's a great number. Very excited to have everybody on here to talk about another topic on COVID. I wish it was something else we were talking about today, but eventually I think we'll get there and we'll have some other topics to discuss rather than just COVID. But regardless, welcome. We're going to talk today about this new OSHA standard that may come out. And I'm going to talk about some of those compliance dates and what's on the horizon for the court rulings. But moreover, talk about a compliance tool that our development team here at HASC has created to allow you, the employer, to not only comply with any mandate that comes out, but in general, just help you track your employees' vaccination and test status. We understand that's a headache regardless of a mandate, right? We have to try to keep tabs even now of who in our companies are vaccinated, who's positive, who's negative, all that hassle that we've all been dealing with. Then you lay on top of it an employer mandate, and it just becomes even more of a headache. So we have created this tool to offer our members of HASC, and we want to share that with you today. So again, welcome. So today, hosted by myself, I'm Tommy Heisler, the Chief Medical Officer here at HASC, as well as Jason Welsh, who is our Vice President of IT. Jason's team is the ones behind the magic of this tool. So he's going to give you a live demo after I share a few slides. So we cannot do these webinars without the support of not only our members, but also our sponsors that help us along the way with these endeavors. As many of you know, we have hosted a whole slew of webinars throughout the past couple of years in partnership with the University of Texas to offer as much guidance and education as we can throughout this pandemic journey. And again, we thank you to our sponsors who have contributed to those efforts. Again, could not do it without you. Thank you very much. So obviously we're talking about vaccination stuff today and vaccination mandates. So I just wanted to give you a snapshot of how we're looking in the US as far as vaccination is concerned. So if you look at these numbers and you look at the far right-hand side of the numbers there, it shows you how well we're doing getting people vaccinated. So those are the numbers of who has been fully vaccinated in the United States, and you can see the breakdown of demographics. Hey, if you're above 65 years old, your group has been awesome with vaccinations, over 87% fully vaccinated, which is great. That is the population that we wanted to get vaccinated early and fully, because we know from what we've seen throughout this pandemic, it's that vulnerable population that unfortunately has succumbed to COVID-19 the most. So that demographic is doing well. If you look at the overall population of the US, we're hovering around 62% fully vaccinated. And again, right now, the definition of fully vaccinated does not include the booster. It just includes either your 1 dose of J&J or your 2 full doses of Pfizer or Moderna. So when we talk about maintaining these COVID records, what's the goal, right? Well, the goal is to be able to provide you, the employer, with an easy tool to document these records, whether it's a COVID test, whether it's a vaccination status, something to help you, right? Because if you don't have anything, what are you at the mercy with? Yeah, you know, it could be sticky notes on your desk, it could be a spreadsheet. But then as you get more and more job sites you have to manage as a corporate initiative, things get a little sticky, right? We wanted a tool that was across any business sector. You don't have to just be in petrochem to use this tool, right? this potential mandate that's coming out says it's for any industry. It has to be for every industry. So regardless of what a mandate says, we know that the capabilities of employers to manage this stuff can be pretty messy. And whether or not you have 100 employees or 1,000 employees or 100,000 employees, you still have to go through a lot of these hurdles to make sure you are maintaining a good roster and a good database. You throw in that COVID mandate in there, and then things are more of a hassle, right? So when we were looking at this, our team got together and said, well, gee, what do we need as an employer, right? We're an employer. The Health and Safety Council employs people at multiple locations. So we knew we needed a tool. So if we knew we needed a tool and what we wanted this tool to work for us, we knew that we should offer that to all of our members at the Health and Safety Council. So what does the new OSHA ETS look like? If you haven't gone through it line by line, that's perfectly fine. We did the work for you, and we're going to kind of summarize those highlights of what the standard says you as an employer, if you have more than 100 employees, have to do to maintain compliance. So the purpose of the standard is to establish minimum requirements for vaccination, facial coverings, and testing to address COVID. It says it is to preempt state and local inconsistencies, right? So one town says you have to wear a mask, another town says no, you don't. One town says you'll have to be vaccinated before you go into a restaurant, the other town says no. This standard says its purpose is to try to eliminate that, at least on an employer-employee level, and make things consistent. The key word is minimum. OSHA says that you can certainly do far over and beyond what the standard says, but as a minimum to maintain compliance, you must have these steps in place. So where do we stand with all the court battles? Well, the latest appeals court a couple of weeks ago said this mandate can proceed. It is legal, it can proceed. One of the justices from that opinion said that OSHA's authority includes protection against infectious disease that presents risk in the workplace, and it doesn't matter where the risk comes from. Even though you get COVID from the grocery store, if you bring it into the workplace, you are then presenting that hazard to other employees. Therefore, OSHA has the right to mitigate the risk, and therefore roll out this mandate. Now, it's going to go to the Supreme Court this week, Friday. The Supreme Court has agreed to hear emergency oral arguments for both sides to determine if they think the mandate can proceed. It's interesting to note that to date, the Supreme Court has sided with every mandate that has come before it. Those mandates have been at the state and local level. This one obviously is much bigger and much broader at a federal level, which is why they've agreed to take oral arguments and to make a more robust decision on it. All right, so be looking for Friday to see what happens or what those oral arguments are, or maybe which way that you think those justices are leaning. The decision may not roll out on Friday. It may be over the next week or so, but it'll be a very important day to watch. So let's assume it goes into place, right? Let's assume that the justices continue their approval of these COVID vaccine mandates and it goes through, right? So what does the standard say? It applies to any employer with a total of 100 or more employees at any time, right? So what does that mean? Just because you have 100 today and 99 tomorrow, it's going to apply to you, all right? If you have a total of 100 employees at any time, whether that's at one job site or corporate wide, it will apply to you. independent contractors that you pay do not count towards that 100 total, okay? It also does not apply to healthcare workers because they are covered under a totally different healthcare worker OSHA standard, all right? It also does not apply to you if your workplace is covered under the Safer Federal Workplace, that should be workplace, not work black, workplace entity. All right, so for whatever reason you happen to fall under that program, you're exempt from this. Workers that are working from home are not counted in your total. They do not have to be included in this standard, right? If you're working from home, you're at home. You're not at a job site, so you don't have to adhere to this particular standard. Also, any worker that exclusively works outdoors is not covered under this standard. They are exempt. Now, what does exclusively mean, right? Just because you have scaffold workers working outside doesn't mean they're exempt, because if they have to go inside the lunchroom and eat, or if they have to go inside the security building, they're automatically not included in the word exclusively. But if for whatever reason you have landscapers that go from their house solely to an outside work environment and then go home, maybe they're included in that working exclusively outdoor definition. All right? If they do not report to a workplace where other people are present, if they happen to work in an igloo in Alaska by themselves, they're exempt, right? If they're working in a workplace where no other employees are around, they don't come in contact with anybody at that work site, they would potentially be exempt from this standard. All right? Probably not a lot of our workers would fall into those definitions. So, what does the standard say that all employers, which regardless of which path, vaccination or testing you take, you must adhere to? Firstly, you as the employer have to determine the vaccination status of every one of your employees. That's step number one, because everything hinges on whether or not those employees or that individual employee is fully vaccinated or not. Okay? You must require an acceptable proof of that vaccination and keep a copy of the proof. All right? And the OSHA standard lists everything that they say is acceptable: the vaccine card, a letter from the clinic, the vaccination printout of the record. They go through all of that. But long story short, you must keep a copy of that proof. You must also create and implement a policy. And I have it written twice there, apparently. Policy. Keep a written policy, because OSHA says in their standard, we can ask to see a copy of your written policy. Firstly, make sure you have a written policy, and number two, make sure you are adhering to the policy. So if you decide as an employer that you're going to go the vaccination route and require every one of your employees to be fully vaccinated, you have to have a vaccination written policy. If you go down the testing route where you say we are not going to require all of our employees get vaccinated, we're going to allow them to weekly test, you have to have the testing policy in place. The good news is that OSHA's website that you can go to, that I've listed there, has these templates for you that you can just fill in your specific information for your company. You don't have to reinvent the wheel. You don't have to go create this yourself. They have the templates that you can use. All right? Next, the standard says you as the employer must support vaccination for all of your employees. What does support mean? You have to allow up to 4 hours of paid time for that employee to go get their vaccine at their regular pay rate. You have to pay them for the time they're traveling to go get that vaccine as well, up to 4 hours for each dose. You have to allow paid time off for recovery from adverse side effects. If you've gotten your vaccine, you know you feel pretty crummy the next day. A lot of times employees will call in sick the next day because they're achy, they've got a fever, they just feel miserable. OSHA says you have to allow for recovery time for the adverse reactions. They don't specifically give you a time frame for that. They just say an acceptable amount of time. All right? And you must allow for COVID testing for employees who are not fully vaccinated. You do not have to pay for it. You just have to allow them to have that test. If you're not going to mandate the COVID vaccine, then you have to allow for the testing process to take place. And of course, we're going to talk about what that looks like. But maintaining that living roster of who in my company is vaccinated is the first step. So if you go down the path of, well, we're not going to require vaccinations, now you fall into the COVID testing protocol. It applies to any employee who reports to work at least once every 7 days. So if that employee goes to the office 1 day a week, they have to fall into the testing protocol. That employee must be tested at least once every 7 days. It can be more than that. It cannot be less than that. At least once every 7 days, and they have to produce that negative test results no later than the 7th day from the last test. All right? Sounds like a hassle, right? The primary reason that we created this online tool to do this for you, to be able to input that employee into the testing scheduler, and the tool will keep track of when that employee has to test and when they are in non-compliance. The employee cannot test themselves and interpret the test result themselves. That does not meet the definition of testing in the OSHA standard. The employee can perform their own nasal swab at home, but either you, the employer, or a telehealth healthcare professional has to visually watch that test being run and interpret the result. And of course, I think we understand why that is in the standard. So employees just can't say, yeah, I tested negative today. Here's the photo of it. They want the employer to actually interpret that result or have a telehealth provider interpret that result. All right? What do they say about, well, what if my employee's on vacation for 2 weeks? If they fall out of the weekly testing program because they're out sick, they're on vacation, whatever the case is, they have to show a negative test within 7 days before they come to work. All right? It can be the day before, it can be the hour before they return to work. Doesn't matter. Within 7 days before returning to work, they have to be able to produce an acceptable negative test. No work, no test, no work. They would be out of compliance to return to work. If you have an employee who tests positive for COVID, the OSHA standard says they are waived from any weekly testing for 90 days. And why is that? Because we assume they are now immune for 90 days. They're protected. So they do not have to enter the weekly testing program for 90 days after their positive test. When can that positive employee return to work? After they meet those 3 bullet pointed criteria. If they receive a negative PCR after a quick test showed positive, the PCR can overrule that positive test. They can go back to work immediately. If they meet the regular CDC isolation guidelines, which we all know just reduce to 5 days, they can go back to work. Or if a healthcare provider says, yeah, I think they're okay to go back to work, that's acceptable too. Last bullet point on this slide. The employer must keep a record of each test result provided by the employee, right? Another hassle for you. The employee shows you their positive test, or you test them at the job site, whatever the case is, you have to keep a record of that test result. The standard does not say you have to keep a photocopy of the cassette of the negative test result. It doesn't say you have to keep a copy of the lab result. It just says you have to keep a record. That could be a date and location where the employee took their test. Whatever you think is acceptable as a record will be okay for this. It does not specify you have to keep a photocopy. All right, but you have to document and keep some sort of record of that test result. In this standard is also specific requirements for facial coverings. If that employee is not fully vaccinated, they also must follow the facial covering guidelines. The employer must assure that each employee who is not fully vaccinated wears the facial coverings. That facial covering must be 2 layers thick. That facial covering must be securely adhered to the face with ties, loops, headbands, whatever it is to securely keep it to the face. They say if that employee uses one of those pull-up gaiters that they keep around their neck, the gaiter must be at least 2 layers thick, or when they pull it up, they have to double layer it to make 2 layers covering the full nose and mouth. The employee who is not fully vaccinated must wear that facial covering at all times if they are indoors or if they are riding in a company vehicle with another person. Exceptions to this: if the employee is by themselves in an office with the door shut and there's nobody around. For a brief time while eating or drinking, makes sense. For a brief time for security reasons, right? I need to see your face because I need to check their ID, that's fine. If wearing a face covering creates some other kind of greater harm or hazard, then you're exempt. Okay? So just know it's not only about vaccination and testing. OSHA does put in the standard about specific guidelines for facial coverings. Records releases, right? Let's talk about that. COVID records must be kept as a medical record and privacy protected, right? So they just want you to keep this stuff protected. Don't show it to everybody, right? Don't show vaccination status to people who don't need to see it. Don't show test results to people who don't need to see it. Assume it is a medical record and protect it as much as you can. So what are the time frames if OSHA walks in and says, I want to see your records? Or if an employee says, hey, I want to see what you've logged for me for my test results. The time frames are as follows. If an employee requests their records, you have to give it to them by the next business day. If it's at OSHA's request, you must provide within 4 hours your written policy or your aggregate numbers. What does aggregate numbers mean? They may walk in and say, show me your total numbers for everybody at this job site that is fully vaccinated. You have to be able to give them that data within 4 hours. You don't want to be scrambling, trying to put together a spreadsheet when OSHA calls you up. Another reason why we knew that a quick tool that could spit out that report immediately was vital to helping you out in this compliance. Number 3 bullet point there. If at OSHA's request by the next business day of any other records that they ask for. right? So within 4 hours, if they ask to see your policy and your raw aggregate numbers, by the next business day for everything else. Let me see your copies of all of your proof of vaccination for this job site. That would be considered all other records by the next business day. All right. Compliance dates, right? This is the dates as it stands now, okay? January 10th, all requirements other than testing. February 9th for testing for all employees who have not been fully vaccinated. Now, of course, we know this may get kicked down the road. It may be squashed altogether. We'll have to wait and see what the Supreme Court says. But this is the compliance dates as they stand now. So if you're going to roll out the testing policy, you have to be in compliance by February 9th, assuming everything rolls out according to plan. So, summary of all my slides here, right? What do you as an employer have to do to be in compliance with this ETS? Number one is you have to decide whether you will mandate vaccination or allow for testing. Okay? You probably need to know that pretty soon to be in compliance with the mandate if it rolls out. Once you decide which path you're going to go, you have to create and enforce one of those written policies. Vaccine policy, testing policy. Again, those are on the OSHA website. You don't have to reinvent the wheel. They've got them there for you. Okay, you've decided which route you're going to go. You've got your policies. Now, how do you maintain all the stuff? You have to maintain a roster of all of the employees' vaccination status, regardless of if they're testing or not. Our tool that we created inside of Link will do that, help you do that. Keep a copy of the proof document, the vaccine card. You can upload those inside of the tool in Link. If you go the testing route and you're testing every week, there's a scheduling piece in the Link tool that would allow you to keep track of who's due or who is out of compliance for the weekly testing. If you're testing your employees, maintaining the record of the testing results each week, this piece is in the tool inside of Link. Producing those reports quickly if OSHA walks in the door is included in the Link platform. Folks, this is what you have to be compliant. Yes, or there's some other stuff, the facial coverings and the minutia, but maintaining the records is the key. And we've created this nice, simple, easy, free tool for you to be in compliance. All right? So with that, I'm going to be quiet for a few minutes. I'm going to pass this over to Jason, who is our IT Vice President, and Jason is going to give you a nice, quick little live demo of what's in store as far as our tool is concerned. Jason, I think I've just given you control, so take it away.
All right, thank you, Dr. Heisler. Let me just get set up with the screen sharing. All right. So, as Dr. Heisler mentioned, this is within our Link platform. This feature, just a second. This feature is within our Link platform. Link is our client portal. It's used by owner facilities, contractor companies, for all their interactions with the council. Let me go ahead and log in. And one point I want to highlight first is that anyone out there in the audience that is already a member of HASC, if you log into your Link account, you will be able to see these features that I am about to show you. Everything I'm about to show you is live in Link for HASC today. Given that a large portion of the record keeping around this new COVID standard for OSHA is around building up a roster of your vaccinated folks and also your people that need to be tested weekly. We tied this in directly to the roster functionality that was already within Link. Let me briefly clear this like that. So I'm back to the full roster. Anyone who's familiar with Link should be able to recognize this this screen. Hang on 1 second. Okay. So what we've got here, listing of people who work for your company. In this case, I am in a demo account, so I'm not seeing a lot of real pictures, no real names, all made up people. Your account, of course, will have your real people who have been taking clinic services with us, taking training with us. Click into one of these people, and I have a new option up here in this menu called Set COVID Status. This allows you to opt this person in to the record keeping around COVID and the OSHA standard. Click that, change off of Do Not Track, and you have two choices right now. These are the two ways that that you can be in compliance with the standard. You're either fully vaccinated or you're under a weekly testing program. Let me show you the fully vaccinated workflow first. We do allow an upload of the card. I'll show you what that looks like in a bit. Just simply fill out a few fields. The effective date of your vaccination, the manufacturer of your vaccination, and then check this checkbox. The person who enters this data needs to have been the person who is in a position to vouch for the fact that this vaccination did happen. This is the person, the responsible person who's been designated at the company to be approached by the employee, shown the vaccination card. This is a part of the OSHA standard that with the vaccination, we also track the name of the person at the company who is in a position to vouch for this vaccination. This checkbox gets at that in that the person entering it is affirming that this information they've entered is true and accurate. Click Save, and then that opens up a new area of the screen below the demographic information called COVID compliance status. In this case, there's not a whole lot of functionality. Once you're fully vaccinated, that's it. You're good as far as the OSHA standard. We do, for both types of compliance, we do allow a report to be run for the individual. If I run that report for the person who's been vaccinated, you see a combination of things. Any testing history that they may have underwent before becoming vaccinated is listed, as is the dates of their vaccination and the, of course, vaccine name. If I exit out of this, I can also go back and show you what the weekly testing workflow looks like. Click that. That opens up a COVID compliance status of testing weekly. In this case, this test had already been logged for this person. I can go in and log a new COVID test. Let's say they also tested on the 20th. They were negative. As you can see here, this screen will always show the date of their most recent test. The report, however, will show a running log of every test that has been put in for this person. This is a report that would be very helpful if anyone, if there was ever any kind of audit, any questions, someone wanted proof that that a certain person, anyone wanted proof that a certain person was compliant with the standard, you could provide this report and hand it over for that, for that person. This will span as many pages as necessary. As you can imagine, if this process goes on for months, years, we're going to quickly have dozens, if not approaching 100, the potential for hundreds of test events to be logged here. This report will cover them all. This is an individual who's fully vaccinated. As you can see, their vaccine card is always available right here for download anytime that needs to be referred to. It doesn't, it is not currently a part of the OSHA standard, but just as an internal best practice, you may want to use the system as your record keeping for images of the vaccine card. On the flip side of that, and also this gives me an opportunity to make one other point. What we're seeing today is just a starting point. This standard developed pretty quickly. The language was not finalized until might have been about a month ago, maybe 5 weeks ago. So we quickly built this system as a starting point that does let you satisfy the requirements of the standard, but it is still very much a starting point. We recognize that there will be future enhancements that that will make sense to be made to this system to make it easier to use, make it more full-featured, perhaps let it even comply with some company standards you wish to implement that go above and beyond what what the OSHA standard stipulates. We will be adding those as time comes, and one example of that is this feature to track the vaccine card. We are going to be adding a similar feature to the testing, the logging of the weekly testing, that lets you capture an image of that weekly test. The report that was provided by the clinic that ran the test could be scanned to PDF, snapped a picture with your phone, or one of those two options is going to be the most typical, and then uploaded into the system for safekeeping, for reference purposes, that sort of thing. So that is how the data capture works for the individuals who are either testing each week or have been fully vaccinated. So that brings us to this roster screen itself. We have added some filtering that will come in handy with this functionality. First, we have COVID compliance status. This would be a report, or this would allow you to filter this screen and produce a report that shows all your fully vaccinated folks. So pick fully vaccinated, hit update. In my case, in this test account, I've got 5 people that are listed as fully vaccinated. I can click export, export to Excel, and there I've got my report. Similarly, there is also a PDF report if that is more to your liking. Excel, of course, allows additional sorting, manipulation. There's things you can do with Excel that you can't with PDF, but sometimes the fact that PDFs are not easily changed is a good feature for exporting to PDF. If someone was asking for this outside your organization, PDF would certainly be the way to go. You can also run a list of your testing weekly, export that. And in this case, and I'm getting an indication that this may not be shown. 1 second, please. Sorry for that. I'll describe it just in case it's not coming through. GoToMeeting is telling me that screen sharing is paused. So it's an Excel report that lets you see not just the list of names, but it also shows the date of the last test and the result of the last test. So that report becomes a good way to keep tabs on who has recently tested positive. Another way to keep You can run this search feature last positives tests, update that. That'll show you everyone whose last test was positive. Anyone who is currently out of compliance, you can also search on that with the roster screen. Click update search, and you've got three people that are listed as being out of compliance, and that is simply because they have not tested within the necessary 7 days. I believe this is the extent of the system so far. It's a great start to getting information captured and reporting. You know, you have the most necessary reports for complying with the OSHA standard, and there is certainly more to come in the future. In addition to the test results imaging feature that I mentioned before, another thing that we will be adding is a way to help with mass loading of test results. Like, say you send 24 people all to the same clinic because they all work out of the same office. You happen to know a clinic, 5 minutes down the road is the best place for all of them to go to. It could be a pain to enter one after another that clinic information over and over and over again. We're going to streamline a way for you to enter those, say those 24 people quickly that all went to the same clinic, and the vast majority, all tested with the same result. And then another thing we are going to be adding is a third status in addition to testing weekly, or not necessarily a third status, but when you think about it, someone could start under the weekly testing program, decide after a few weeks, you know what, maybe I will get vaccinated. We're going to add some features to this system that help you manage that transition from the weekly testing program to the partially vaccinated to then fully vaccinated. So that's another feature that we have slated for the near future. And then, of course, more to come with the feedback, with the help from feedback of our owner facilities and contractor companies that start using this feature. Let me turn it back over to Dr. Heisler.
Thanks, Jason. Feel free also to our attendees here, if you like to type in a question, feel free to type it into the question box. We've got several that have come in. Jason, one question that came in that was an IT related, is Link a standalone system, or can it be integrated into our company's HR system or any other system that we have?
It is a standalone system. It's a standalone web application. But that being said, we have already programmed some APIs, that's application programming interfaces, that are designed to allow communications with another system. So that expanding that concept can always be evaluated if there's ever a need for this data to be communicated with a client's home HR system.
Another one was, does the COVID testing record always stay with the employee, similar to HASC training records?
It doesn't. It does not travel with the employee from company to company, because when so the vaccine will have to be revalidated as that employee moves to a new company. The reason behind that initial design is due to the belief that the standard requires someone at that company to have been in a position to validate that vaccination or to validate those tests that came in. And so we thought it would be safest to not have that vaccine record travel with the person.
Right, and I think that definitely makes sense, because even in the standard it says, keep this as a medical record. Well, companies don't share medical records of their employees, right? Every company is responsible for new medical records, things like that. So that definitely makes sense. Let's see, if you download the card, I guess, or upload the card, how do you retrieve it when requested by somebody?
If you upload the vaccine card, you would just click into that employee and there's a link that appears next to their fully vaccinated status that allows you to open up that in PDF format.
Great. Another question was about identifiers. How do you register an employee in the system? Do you have to use a social security number?
As of right now, and as almost everyone on this webinar will be aware, this is a system that's built around safety training records that have a need to travel from company to company, possibly council to council in the case of HASC training. It is built around the social security number being the primary identifier of the person. We do take great care with those social security numbers, both from information security practices we have in place here, but then also just best practices in a web application of keeping that social masked, never producing a list of full socials, that kind of thing. But yes, as of right now, to create that individual, you do put in a social security number. That is something we are looking at options for in the near future to change. But today, social security number is a required field for that employee.
Gotcha. One good question was if HASC performs the weekly testing here at one of the clinics or on site, does that test result automatically input into the system? And I know the answer, but you want to?
Yeah, and that was in my notes to mention during the walkthrough, so I am very glad that came up during this portion. Yes, as if you take the test with HASC, you don't have to do the step of logging the test. The test will just move right over from the clinic function into the COVID tracking function, and it will just be there for that person.
Excellent. Let's see here. Some of these questions that I probably cannot answer, but will a copy of the PowerPoint be provided after the meeting? Absolutely, nothing is proprietary here. So we will post that to our website along with a recorded version of the entire webinar. So you're welcome to go back and take a look there. Let's see, a lot of questions on pricing of this. Again, if you're a member of the Safety Council, this is a free tool. You already have it there for your use. There's no additional fee per employee you're trying to track. I mean, this is not a money-making tool, right? This is a tool to help. So if you already have a member, you pay your annual membership to the council, you get this. This is link that you have access to. If you don't have access to it, just call us up. We'll give you the username and credential, and you already have it activated in your company's or your user's profile. Let me see if I can answer anything else here. There was a question about out-of-state employees, and does this apply to the mandate still apply to out-of-state employees? Yes, this is a federal mandate. This supersedes any state or local policy as it relates to employers. So yes, it is a blanket standard for your employees. If they're in Texas or they're in Oklahoma or Nebraska, it doesn't matter. This is a federal policy. It has to be adhered to no matter where you are working. If your company falls into the criteria in which you would have to be compliant. 100 or more employees is the basic threshold for if you are included into this standard. Jason, I'm going to share my screen again, and if you want to talk a little bit about Link Mobile.
Sure. So yeah, this is just to get some awareness out there. We have recently launched a mobile application in both major stores, app stores, of course. We're talking the Apple Store, of course, the Apple App Store, and then of course the Google Play Store for Android devices. A lot of useful features there, things that you can of course do within Link, but sometimes doing them on the go is necessary, and so we built the tool for this. Also, there's some features in there for the contractor employee themselves, the individuals that are being sent here for training or for clinic services. They have some features here as well. So that's it. It's not currently tied into our OSHA tracking system, but that certainly could come in the future. But just trying to get the word out.
Excellent. Another question that popped up was, is there a way to identify the people who can access the COVID compliance information if we have multiple users of Link?
Right now, if you have access to the roster and to the employee detail screen, you have access to this feature. So it, anyone who's used to seeing the screens that led up to the new functionality that I showed, it will be there for you.
Gotcha. All right. Let's see here. What other questions do we have here? Will the OSHA 300 log be used to establish your number of employees? The standard doesn't specify. It just says if you have 100 or more employees at any time, regardless if that's at a job site or corporate wide, you fall into this category. They do not say you have to use the OSHA log. They do not say you have to use tax records. They don't say anything specific. It's just count the number of employees you have, and if it's more than 100, you fall into that category. And I get it. If you're a company of 99 employees, this may be a little tricky for you to try to figure out, do I meet the threshold or not? But they don't give any real clear guidance to that definition. After the program, can we receive pricing for the tool? I think I explained some of that a little while ago, but feel free to contact us and we will be happy to give you a private one-on-one demo of the system and help you get your roster uploaded and help you get started on using the tool. A question was, so workers in cubicles have to wear face coverings? And the answer is yes, if they are not fully vaccinated. The only exemption inside of an office that the standard says is allowed is if they are working in an office by themselves with the door shut. Okay, so working in an office with 10 cubicles is not working by yourself. So yes, if they're in the cubicle and they're not vaccinated, they would have to adhere to the facial coverings. Yep, absolutely. Okay, we answered this one. We answered this one. Again, talking about pricing, and again, I'll just reiterate, if you already have a membership to the Safety Council, you get this. It's included. There is nothing to it. So the point of that is, if you're not a member of the Safety Council, you should be a member of the Safety Council. You get these free things as an added benefit to your membership. If you are fully vaccinated, does that employee still need to be tested within 7 days before returning to work? And the answer is no. If you're fully vaccinated, you don't have to do any testing unless that's your own company protocol and that's your process. But the mandate says that if you are fully vaccinated, you're done. You don't have to be tested as part of the standard. The weekly testing and the testing before you come back from vacation only applies to the people who are not fully vaccinated. Then they fall into the testing section of the standard, in which case they would have to be tested before they come back from their leave of absence. Jason, you alluded to this a little bit, but just to reiterate, because it's a question, can employees create an account on their own and upload their own stuff and keep track of their own stuff?
Yeah, not currently. It is built currently around the concept of an administrator at the company entering this data. It's certainly possible, especially, I mean, from a technical perspective, we would have to make some changes, of course, but it could be done to where the employee logs this information themselves. We would just need to, take great care that things were still being done in accordance with the OSHA standard, because I know in a lot of cases it's important that a third party, in most cases, an administrator at the employer, help, vouch for these activities, these documents, and so forth.
Right. Another question, and this reiterates the user permission question that we just had. The question was, I want to be able to, it would be nice to be able to have, the people at my hiring office that schedule training not have access to the COVID compliance tracking. And I would say that probably is something we're going to work on in the future. We certainly have that option on the medical side of Link, where you can assign somebody to be the DER, where they get access to certain medical things that other people don't. So I would say that is definitely something that is probably easily doable. It's just not rolled out on day one.
Right. Yes, that's correct. Yeah, I think the administrator would be able to control who else on the account would have access to these features. But again, that will be a future enhancement.
Right. A question about riding in vehicles, and the question was, if my employees work outside all day, but they have to ride in a truck together, they share a truck, and if they're not vaccinated, then yes, they have to wear that mask inside the truck, and they would have to follow the testing protocols, right? Because they're not working by themselves exclusively. They're not working outside exclusively, because they're going inside of the truck, right? The purpose of this standard was to make that requirement very strict. Unless you're working by yourself solo in a cubicle in an office with the door shut, you're not going to meet the exemption. If at any time you have to be around coworkers, you're going to fall into the testing protocol if you are not fully vaccinated. So yep, that is exactly right. It looks like we're almost down to our last couple of minutes here. There are a handful more questions that we did not get to. As always, we will answer all of these questions in written format and give them to you. So rest assured, you're going to get all of these great questions answered, and we hope that the information today was helpful and useful. As always, other services that we can help offer. So if you need COVID testing, if you as a company are going to test these employees at your job site and you need access to bulk orders of testing kits, feel free to reach out to us. We can try to help you solve that problem if we can. Again, if you want a live demo of this, if you want some hand holding along the way, we're happy to do that. We're great hand holders. Reach out to info@hasc.com and we'll get you set up in the system, get you username and credentials, get your roster uploaded, give you a demo, train anybody we need to. That's what we're here to do. So again, we thank you very much. And with that, I'm going to end this broadcast, and we hope everybody had a happy new year and you stay safe and stay healthy. And until we meet again, take care.